am sorry that I haven't read your book, but I did order your book. So as soon as it comes, I am going to order. But you say the cardiologist guide to what really works. So what really works? What works?
Yeah, I mean, well, I'm not going to give away the whole book, right? No, just kidding. What works is focusing on nutrition, exercise, stress management, understanding why you want to be healthy. It's a multi-legged stool, but the thing is, there's not one thing that works. And I think that's part of the key, right? It's not just eat this one diet and that's takes care of everything. And that's really the fallacy of a program like the Ornish style program, that it's the vegan diet is going to cure you. Well, no, people stopping smoking, having their cardiovascular risk factors aggressively assessed and treated, exercising, it's a multimodality approach. And many different dietary interventions can work for different individuals. But a big part of it is, what diet are you going to stick with? Food is so much more than just health and energy. And it'd be a lot easier if that's all it was. But it's enjoyment, it's pleasure, it's socializing, it's families, it's our history, it's our ethnicity. So much of that is enrolled in food. So to think that we can prescribe one diet for the whole world or even one country to eat is just a complete fallacy and doomed to failure, which is exactly what we've seen over the past 50 years of trying to, teach people to eat one diet. So there are a lot of different approaches. You have to find the approach that's going to work for you, but with certain parameters, right? Ones that are going to help you eat less naturally, ones that are going to give you plenty of protein, and ones that are going to improve your metabolic health. Because when it comes to metabolic health, nutrition is probably the single most important thing you can do. So you need to find a dietary approach that can fit those things. Now, a low carb diet tends to hit all those parameters and can have multiple different facets or different versions of a low carb diet to fit people's taste, to fit people's ethnicities, to fit their culture and their background and so forth. So that's why I am a big proponent of low carb diet, but it's not one thing. It's many different versions of it.